So as you know, I'm Neal Karkhanis. My major is Management of Aging Services, and I'll be graduating this May. So what we did was, obviously, the survey of students' knowledge, attitudes, and beliefs about seeking care for their emotional and mental health problems. So this is my outline. I'll be hitting the introduction of why we did the study, the methods of how we did it, the results being what we found, and the conclusions, what does it all mean. So just to get started, suicide is the second leading cause of death among all college students, second to traffic accidents. And the number one cause of suicide is untreated depression. Depression is typically diagnosed in a person's 20s. Statistically, it's typically done, first typically found between ages 18 and 24. So obviously college is a big transition. There's lots of stresses. We're meeting new people. We're dealing with academics. We're dealing with jobs. So we have social, academic, professional stresses among many others. Depression may be hard to recognize, and it's a stigmatized illness. Many people feel embarrassed to say that they're depressed or access the care that they need. And because of this, barriers may impede the access to care. Continuing with that, typically people that are most affected by the stigmatization of care, it's done because of their culture, their race, ethnicity, their socioeconomic status, and their gender, as well as many other issues. And we felt that this was very important at UMBC, especially because UMBC is a very diverse campus. Just walk into that ballroom and take a look around and see yourself. And so that's why we did the study. So the questions we wanted to answer were, what's the level of need? How many students are depressed? What predicts depression? What are the suicidal ideations? Is there unhealthy coping mechanisms going on? What's causing the stress? Are there any barriers to care? Who even knows about the university counseling services and who doesn't? So first of all, we need to get our survey approved by IRB and CACC, so they approved it. And then after that, our survey consisted of depression scales, 2 mental health stigma scales, standard demographics, and we pilot tested it in a few of Professor K's classes. The general demographic questions covered gender, major, what year the student is in, their GPA, whether they're a transfer student, their language, among many other demographic questions. And it was fielded through April 6th through the 17th. OIT helped us out by getting us a 11,000 name list of email addresses, and then we randomized it and picked 2,500 out of it. Students were given the incentive of 5 $100 gift cards to take the survey. And the data was analyzed using SPSS. So the demographics of the responders were, we sent it out to 2,500 different students. 825 actually completed the survey. About 856 started the survey, but only 825 completed. So there was, I think that works out to like 95% completion rate. 55% were female. So I believe 44% were male and less than 1% were transgender. The type of student, 80% were undergrad, 13.7 were masters, 6.3 were doctoral. You can see the race spread as well, 60% Caucasian and so on. So 35.5% were transfer, 84% were full-time. The sexual preference, 90% heterosexual, 2.6 homosexual, and so on. A key demographic statistic that we found was that 8.4% of our sample don't have insurance at all. And out of 825 that completed it, 8% is around 75 people that don't have insurance. So that's a pretty big number. So those people can't even access the care that we're supposed to be providing them. The next slide. So based on a couple of questions, we were able to come up with these statistics. We did a short depression scale, and of the people that took the survey, 36% ended up being depressed. That may sound like a small number, but that comes out to about 300 people that took the survey that are depressed according to our scale. And in the past 12 months, have they had an emotional stress-related problem that affected their academics, their professional life, their family life, whatever it is? 46% said yes. So that works out to about 380 people that took our survey. That's a large number. So we were able to use cross-tabbing to decipher what type of person answered which question. So through that, we were able to see, what the non-heterosexuals answered on the depression scale and so on. And by doing that, we found that 60% of non-heterosexuals are depressed compared to 45% heterosexual. And the list goes on. English not a second language, 54% to 44%. Being female, 53% to 37% compared to being male. Transfer students are more likely to be depressed. Low socioeconomic status, likely to be depressed. Being a minority. And the thing that surprised us the most is that working 20 plus hours per week was not predictive of depression. It was just predictive of not knowing about services provided, which we'll be covering soon. So one of the questions was, have you ever attempted suicide? And another question was, have you had any serious thoughts of it? And we came down to 6.2% of people that took the survey have attempted suicide before. That works out to 53 people that took the survey that have attempted suicide. It's a scary number. 83 people have thought about it. And those are just the people that answered honestly, so you never really know. You can go, there's the numbers. Did they use drugs or alcohol to cope with their stress? 27% said yes in the last 6 months. 36% said yes ever. That works out to over 200 people in the last 6 months, almost 300 people ever. That can lead to some other major problems. So now we know people are stressed out. People are having some suicidal ideations and so on. So what's stressing them out? Well, as you can see on this chart, the red score is very high, orange is high, yellow is moderate, green is low. Academics, future career, finances, all very, very high on the stress indication, I guess. And with emotions going down to sexual identity being the least. But obviously, at school, academics and future career is going to be a major issue, and obviously everybody right now is dealing with financial issues. So those are the sources of stress. You can go next. So unfortunately, 28% of our survey didn't even know that university counseling services exist. Of those people, people that have children, 61% of them did not know. People that were getting health insurance from their employer, 56% of them didn't know. People that work 20 plus hours, 45% of them didn't know. And the list goes on. So there is some good news. UCS has reached 72% of the respondents and done an excellent job doing it through orientation. However, because certain groups are not adequately being informed, as I showed on the last slide, we must utilize other resources to inform these groups of the services that are provided, either through some sort of orientation for transfer students or specific orientation geared towards to different races or ethnicities. So our conclusion is 36% of UMBC students are depressed. That's an alarming number. Typically non-heterosexual, female, minority, poor transfer students are more likely to be depressed. And of those people that are depressed, 10% of them are suicidal. And if you take that number with the whole campus, that's approximately 1,000 students. UCS is doing a good job of informing people through orientation. However, like I said, we should be utilizing other resources to get specific groups informed. Those groups include transfer students, students that live off campus, graduate students, students that work 20 plus hours, families, and the major ethnic group was Asians. They either had a stigma towards care, or most of them just weren't aware of it. The number was 35% of Asians are not aware of services provided. And this topic hits close to home for me. A friend of mine took his life last year, so I wanted to dedicate my presentation to him. Are there any questions?
you. When you have your respondents, and that's your total number, this is way at the beginning of the presentation, is
Right.
the respondents, and you say that 55% are female. What's the population here at UMBC?
That's female?
Yeah.
Honestly, I don't know.
Is it more than 50%?
I would assume so.
Okay, so that number kind of correlates. That's
Yeah,
really my
although I want to touch on one thing. The statistical significance of some of the data is questionable, given the fact that we didn't get many homosexual students in the sample and so on.
You have to understand as well that we finished fielding the survey on Friday, and we did the data analysis on Monday. So one of the things that we need to do is look up to see whether our respondents' demographics adequately correlate with UMBC's actual demographics.
Right, and as someone who spent quite a long time here working with international students and Asian students in particular, obviously your 36% figure is very concerning. And I'm also aware of the fact that there's great outreach from whether it's admissions, orientation, and all the various areas to get this information out. And obviously, from my perspective, there's always a comprehension or a clear take from the information that's given. So that, to me, is really the issue. It's not the question of whether the information has been perhaps handed out, it's whether it's been received.
Sure.
And that's part of this
Right, true. I mean, not only,
feedback I offer to you.
right, not only
Part
is,
of solving the 36%.
right. I mean, not only is providing information important, but educating is important. And also, specifically with that ethnic background, there is a stigma towards care. And so that's a whole cultural issue to dive into.
Right, we haven't analyzed any of the stigma scales yet to find out if the UMBC campus is like what we've seen in the literature, because stigma actually could be an additional barrier to care seeking besides not knowing that care exists on the campus. The other thing that we didn't ask, I kind of wish we had, was whether people thought University Counseling Services charged for services, because I wanted to know if a lack of insurance actually is perceived, whether misperceptions about the fact that it's free prevent people from going.
Any other questions? All right, thank you.